The Shift is brought to you by SE Healthcare. Welcome to The Shift. I'm Dr. Andrea Coyle. Hey, Shifties. Welcome back to the next Shift episode. So grateful to have someone that I've known for many, many years, and we reconnected, and just glad that Dr. Fluharty is going to be our guest today. Do a little introduction. Tell the Shifties a little bit about yourself.
So I am currently a nurse researcher, and that comes after spending 18 years at the bedside in a pediatric subspecialty that was incredibly rewarding, but led to the typical types of things that we are finding are all too common in nursing these days, including burnout.
I like how you worded that, Melissa. And and I think that's, if it's okay with you, Melissa, we'll just spend this episode and talk a little bit about um, stress and then contributing factors that led to burnout, how you shifted and recognized, like, oh my goodness, I am burned out, what you did about it, and what you've learned along the way. Because I think it's really helpful, and you and I had talked about this offline, um, destigmatizing mental health for
Yeah.
nurses. It's incredibly important. So tell us a little bit.
So I came out of my associate's degree into the subspecialty where I worked, which is a very intense place. It did involve intensive care of the patients and was a large unit where I grew as a nurse and then took steps to climb the ladder and contribute to my unit and went through burnout actually multiple different times. And I've had a few different shifts from the times that I'm aware of going through burnout. One of them was realizing that I wanted to answer questions, that I had questions no one had answers to. And that meant I was going to do something I had never planned before, and that was continue my education. And that led me to get my PhD so that I could try to answer these questions. And then I stayed in the unit, but was renewed as I started the education process and continued on. And then we had COVID and a lot of other changes with the unit that emphasized that I was not as valued and we were having a hard time being heard as nurses. And I got into burnout yet again. And this time it was really low, but I kept pushing to try to continue to work with the population I had started with. And the big shift was when I realized that I was going to be continuously starting my projects over again from base one instead of moving forward with them, and said, it's time for me to use this degree and find that nursing research position.
And and I remember when you were on your PhD track, I remember all that and all the hard work you put in. And congratulations, Dr. Fluharty. You said something. You said you didn't feel valued and you didn't feel heard. And what we find here at SC Healthcare with our clients and our partnership with the American Nurses Association is that's often in the top, probably top five of contributor stress and burnout is I don't feel valued for what I do, and I don't feel heard. Because, a nurses, we want to think autonomously. We went to school for a long time. We're really
Right.
smart cookies. And to not be heard and valued is very difficult. And I think I've shared another episode. I worked in an organization where my leader, it felt like I was not valued, I wasn't heard, and that contributed to my burnout. So I relate, and I'm sure some of the other shifties out there can relate. What did you do to say no more? Like I want something different. Is that when you got on your PhD track?
Um, it was both as I got on my PhD track, and then again, as I said, it's time to utilize this degree. And the biggest difference the second time around is that I was already receiving help from outside sources.
So I'm glad you teed that up. That was well done. I love that you're very vulnerable. So thank you for your vulnerability. I'm sure a lot of shifties can relate to what you're saying. But you took the step and you were courageous and you were brave. And you obviously must have said something shifted in your mindset that you said, I'm not okay and I need help. And so you went out, did you seek EAP or did you do EAP at your organization and seek something independently? Because what we hear a lot, Dr. Fluharty, is people don't want to go to their EAP because they don't want people to see them there. And we've got to stop that.
Right. Because of my experience while obtaining my PhD, felt that it was time for me to move to someone in private practice simply because I needed a consistency that was not available through school because they are appropriately training their providers and they shift each year to a different tract. So for the second time around, was with a private provider who I'm currently still with. And we were going through my transition from the bedside to nursing research. And I attended a conference that made me ask him a question that he said, wait a second, maybe you're onto something else here.
Mm. And what was that something else?
That something else is I met all the criteria for complex post traumatic stress disorder, or CPTSD, which was shocking to me and it was a struggle to come to terms with, but now I'm learning how to handle that and know that it's not just me and I was not the cause of being undervalued.
You know, it's interesting, and I say this often. These are the things that I believe we need to have these discussions starting in nursing school so that we have the mental capacity to deal with all these things. Not only are we dealing with fragile lives, whether it's an adult or a pediatric or a neonate, we're also dealing with the dynamic healthcare system of a lot of interprofessionals. And
Yeah.
that in itself is a very complex, complicated ecosystem.
Yes, it
Um,
is.
Melissa, will you share? I'm going in and out from calling you Dr. Fluharty to Melissa. Melissa, will
That's
you
fine.
share? Will you share um, how you felt sometimes when you would come home from work?
I felt worthless. I felt like I didn't, anything I was doing didn't matter, that I was the cause of everything, that because I wasn't seeing the changes I wanted to see, despite some people trying very hard, the system wasn't set up. And instead of seeing it as the system set up to help progress the changes through, I found it as a failure in myself and became a very negative outlook in life. Something that not many people realize is that PTSD and complex PTSD can increase your risk for suicidal ideation. And there is something called passive suicidal ideation, where you just wish you wouldn't wake up in the morning. You don't want to do anything to yourself, but you think it would be better if you weren't around for everybody else and they could move on with life like normal. And was definitely having those feelings a lot.
I have a question about that, Melissa. Do you feel like when you were in that work environment it sounded like not the healthiest work environment, do you feel like some of your peers knew something was wrong?
I think some of them did, but everybody is too hesitant to check in at a level because we worry about what talking about our mental health will do to our licenses and our ability to practice as a nurse. And we've had it stigmatized that we're the ones who said, I'll be a nurse. That means I'm going to be dealing with these difficult things. So I signed up for what I'm getting. And we all hesitate to talk about what realities that brings to us and how we have to work that way.
And I'm so grateful that you were courageous and strong enough to take off that coat of armor and be vulnerable and seek the help. Um, do you feel like, because that was a while ago, do you think things have changed? Do you think we're starting to remove the stigma around being honest about, man,
I
I don't feel right today. I need help.
I think we are just now starting that journey, and unfortunately, it took the pandemic to bring that out for us because we made everybody see and hear that we really weren't okay. And the pandemic gave us a position to speak loud enough to say, this has been going on for longer than this. And these are the realities we have.
That makes sense. And do you, will you tell us, let's dive a little deeper into this complex PTSD. How does that present?
So, in the United States, I will go ahead and say that complex PTSD is not an official diagnosis in the United States, but it is internationally. And part of it is we just need the time for the researchers to bring the language up to date into the books that we use for laying out what can and can't be diagnosed. The American Psychiatric Association does recognize complex PTSD and has put out treatment guidelines for it. And what makes it different than just your um, stereotyped post traumatic stress disorder is that in addition to flashbacks, and flashbacks are not just getting lost in a moment and not being aware of all of your surroundings while you relive the event in your mind. Flashbacks can be you have the feelings that you had before of unworthiness or guilt or shame in the moment. It can be just the vivid memories without anything else going on. Um, you have the negative self-talk component and the negative self-beliefs with it. You're distressed, and honestly, I'd have to go back and look up what all the symptoms are, but I know that when my mental health provider and I said this is something that should be investigated after I asked him the question, that led him to say burnout suggests that it could be a part of trauma. He went through the diagnostic criteria and was shocked when I said yes and met every criteria for it. And part of the reason he was shocked was because as of carrying the burden of nursing to myself, I had never spoken about the fact that I was with patients as they died, and these patients were children. That's a burden that we don't speak to enough because too many people are so upset just at the subject.
I get upset. I mean, I can't imagine. So I have a question. I'm not asking you to diagnose me, Melissa. Years and years ago, I was an adult ICU nurse. And often the ICU that I worked in a large academic medical center in the Northeast, we had a response team, a rapid response team. And, when you respond to some of those things, again, I was an adult nurse. I know you're a pediatric and neonate nurse, but some of those flashbacks, like I can still remember a 24-year-old young woman that we coded for like 2 hours. And I can still remember where everything and everyone was in that room. Is that PTSD?
That can be part of PTSD. It will come down to, like you said, how the symptoms affect your ability to handle life. But yes, before I was diagnosed myself, I wouldn't have thought of, when I hear that story or something makes me think of that time, the fact that it's so vivid in my brain, I wouldn't have thought of that as a flashback because I'm continuing to carry on doing what I'm doing. So that can be a symptom of PTSD.
Here's one thing. I remember this when I was a brand new nurse graduate. So I transitioned from academia to practice, and I had to give medications through a G tube. And I had to crunch them all up and you know all that drill. And I remember then I had to put tube feeds in it, and the distinct smell of tube feedings. Anytime I smell tube feeds, it reminds me of that.
Yeah,
Can that be PTSD as well?
that can be. Yes. In fact, I was recently renewing my BLS. And while there for the first time in a BLS renewal, I was having images in my brain of every time I'd been through a code with a patient or in that type of situation. And I could see the moment. So yes, that can absolutely be part of that flashbacks related with PTSD.
I think the important thing is, and I want to make sure I captured this correctly, is I do have moments where I remember it, but it's how you handle it. So it's not like it cripples me or paralyzes me in any way, shape, or form. I just remember it. So
Yes,
is that right?
that is part of it. So where mine is more complex is, and as nurses, we train ourselves to move on and move forward no matter what, but I will internally start feeling all the shame and guilt and failure of how I have perceived things, and I'm trying to change that perception of what happened. And that's part of what my therapy is we go through that and talk about removing my bias from the memories.
Yeah. I think it's difficult. And I think this episode is at the very least going to be very thought provoking, and it's going to make people think a little differently. And I hope every time we have a discussion, I hope it continues to, I don't know if normalize is the right word, but at least validate that some of these feelings we have, they are feelings and they are real, and we need to remove the judgment.
Yes. And one thing in my journey has been emphasizing that just because my journey, from my perspective, has seemed more simple than others, just because of situations, and I don't have as dramatic things happening in my personal life that just make me feel sympathy for other people, that no matter how that is, it's the life that I've lived, it's the experiences I've had. So they're important because they have impacted me.
That makes sense. That makes sense. Melissa, anything else that you feel compelled to share with the shifties as it relates to making this complex PTSD relatable?
Don't be afraid to reach out to someone to start exploring how you've been affected by your nursing career. That I've realized the more I hold it in, the worse I get. The more I fail to share with my family that I feel this way because I experienced XYZ without giving any details to them about it, the more I have to suffer in silence. And we can't continue to deliver care for everybody that we need to care for if we're suffering in silence.
I love that. That's a great takeaway. Any other takeaways that you would love to share?
That, yeah, the biggest shift in my mindset for myself was that it is okay, that this is the reality that I'm living with. It doesn't mean anything is wrong with me as a person from it, and that by going through therapy and getting help and talking with others about it will help me be a better nurse and use all the skills that I gained at the bedside in my research position.
Melissa, I'm so glad that we reconnected, and I'm just so proud, not in a matriarchal way, but just proud that of your courage to come forward and say complex PTSD is a thing. I love that you're thriving. I love that you still love the great profession of nursing. I also respect and appreciate that it's okay to say you're not okay. It's okay to seek help. And that doesn't mean that we're going to leave this great profession of nursing. It just means that we have a difficult role. Nurses have a difficult role. And it doesn't mean that all hope is lost. It just means you need to shift your mindset and get some other tools and strategies to work through some of this. And it really
Right.
happens in any profession.
Yes, very true. And you have given a great platform to be able to do that. And you're very vulnerable yourself. And I appreciate that.
Thank you, Melissa. Shifties, let's all thank Melissa. So proud of you. So glad you're now a shifty. Shifties, remember, your shift makes a difference. Keep shifting. Enjoying the shift? Help us reach more nurse leaders by rating and reviewing us on your podcast app. It takes just a minute, but makes a big impact. Search for The Shift, tap those stars, and share what you love. Your feedback shapes our future episodes and helps others discover us. Remember, rate, review, and amplify The Shift today.